Hi, my name is Dr. Miller. I'm the Director of Central Ohio Functional Medicine Health and Wellness Consulting. Today I'd like to talk to you very briefly about advanced blood testing for hidden cardiovascular disease. The number one cause of death for both men and women in the United States is cardiac disease. Over 1 million people every year have heart attacks. 1,100 people per day have either debilitating or fatal heart attacks. Heart disease, it's silent, it's unexpected, and predicting heart attack risk based on traditional lipid markers is imprecise at best. Over 50% of people who have heart attacks have normal cholesterol. 80% of people with coronary artery disease have normal levels of cholesterol. And even as little as 25% of people who have premature coronary artery disease is directly attributable to elevated LDL. The medical literature and the statistics show you can have a heart attack even if you have low cholesterol. And many people do, but some people who have very high cholesterol live into their 90s, never have a heart attack. So the point is, unless you have extremely high values or extremely low values, you simply cannot rely on cholesterol values alone to assess your cardiac health. More comprehensive evaluation in regards to blood testing is essential for identifying cardiovascular disease in its early stages. The truth is that there's many factors involved in the development of heart disease. High cholesterol at best is just one of those. The sophisticated cardiovascular profile testing is a combination of the standard markers plus independent risk factors plus something called lipid fractionation, which looks at cholesterol size, cholesterol particle size, and cholesterol particle numbers. So you want to be proactive and take preventative steps to protect your health. Let me explain just a little on the makeup here of cholesterol and how it's transported in the body. Protein is attached to cholesterol, and that protein can carry that cholesterol to a blood vessel wall where it can cause plaque. The protein can carry the cholesterol from plaque in the vessel wall to the liver for disposal. That's a good thing. And it can also carry cholesterol on various biochemical pathways to build hormones. Let me quickly differentiate two types of cholesterol that most people are aware of, and that's HDL cholesterol. It's called high density lipoprotein. That's the classification. It extracts cholesterol from plaque and it carries it to the liver disposal. It's a very important antioxidant, has antithrombotic effects. Low-density lipoprotein, just the opposite. It carries the cholesterol to the blood vessel wall where it can cause plaque. So LDL initiates and plays a role in the progression of atherosclerosis. It can also be oxidized, and that is a very important factor. So it's just not the amount of LDL or the amount of HDL on its alone, it's the size and particle number. So that's what the scientific studies have shown. It's shown that particle number is very, very important, and size very, very critical for cardiovascular health. The amount of cholesterol contained per particle can vary. So you could have many LDL particles there that could contain less cholesterol in each particle. The way I explain it to patients is if you have 100 units of cholesterol or $1 worth of cholesterol, LDL cholesterol, you could have 4/4 worth, 4 large molecules, large buoyant LDL. Or you could have that same 100 units, that same $1 worth of cholesterol contained in 10 dimes. 10 particles with less cholesterol in each particle there. So the greater numbers of cholesterol containing particles means more cholesterol deposition as plaque. The higher LDL number, the higher cholesterol deposition is plaque. So the standard lipid profile, you might have it and say, well, gee, I'm under 130, my number's 110, that's pretty good. But in actuality, you could have that 130 units of cholesterol in a significant number of small particles. Your particle number could be high, and your size could be, the amount of cholesterol in each particle could be low. And that they're small particles are dangerous because they can penetrate the arterial walls, create plaque. They persist longer, they can cling to the arterial wall, and inside the arterial wall, these LDL, small LDL particles can be oxidized, and that creates inflammation and it creates adhesion type proteins, and that again helps promote plaque. So LDL particle number and size is very easy to identify, very easy to treat with various lifestyle, dietary considerations, and a number of nutraceutical supplementations options you have in order to change that particle number and size. But vitamins and minerals work in hundreds of metabolic pathways. It's best to measure precisely and accurately which specific vitamin, mineral that you need to drive various enzymes, which genetic mutations you have that would hamper normal enzymatic function and play a role here in plaque formation. So HDL is the same sort of circumstance. HDL is high density lipoprotein. Now it's more than half the people who have heart disease have low HDL. So again, HDL can be small or large. You want the large type. It's called HDL2B, and it's responsible for that reverse cholesterol transport. In other words, it takes cholesterol from the arteries, takes it to the liver. So it extracts the cholesterol from plaque, and it plays a protective role and is crucial for the shrinkage of coronary plaque. So there are multiple treatment options again for large HDL2B. We know that there's lifestyle modifications, dietary considerations, and again, nutraceutical supplementation. So sophisticated cardiovascular testing should just not be the traditional markers of total cholesterol, LDL, HDL, a ratio between total cholesterol and HDL, but it should be a test that includes particle number and particle size, because the medical studies and the clinical experience shows good outcomes when early identification is achieved. Now let me just take it to just a short period of time. I just want to review a couple of independent risk factors that should be measured. There's something called lipoprotein A, little a. It's just simply a LDL molecule that's bound to this protein called ApoA. It has a genetic link. It's an independent risk factor for coronary disease, for cerebrovascular disease, for peripheral atherosclerotic disease. And the management options are a little bit more complex, but management strategies are available to change that number. The second thing I'd like to talk to you, and this is done a little bit more, is high sensitivity CRP. CRP is nothing more than a protein produced by the liver and atherosclerotic arteries, both by your liver and atherosclerotic arteries. It's again an independent risk factor for coronary problems, even if you have normal cholesterol. So it's something important to note. It indicates inflammation. It's higher in patients with hypertension, and again, tremendous treatment options for high CRP that can be helpful. The next marker, independent risk factor that I'd like to talk about is called Lp(PLA2), also referred to as phospholipase A2. Oh my, this is an important one because it's an enzyme produced in the early stages of plaque formation. If you have this marker and it's high, it shows that there's some plaque formation going on. It promotes inflammation, but even more importantly, it promotes plaque instability. And most heart attacks are attributable to plaque instability. The plaque ruptures and you have a heart attack. Again, if you find this high, we use specific personalized interventions to help. Next marker I talk about briefly is something that has to do with clotting. It's called fibrinogen, and high levels cause platelet aggregation and clot formation. It can make your blood too thick. So there are a number of platelet aggregation inhibitors that I use to manage that. It's quite effective when it's identified, and we can change those fibrinogen levels. Another marker that is not hardly tested is homocysteine. Now, homocysteine is nothing more than an intermediate amino acid. There's an amino acid called methionine, which is converted to homocysteine, which should be converted back to methionine. In order for that reconversion to take place, you have to have B vitamins. If you don't have the active form of B vitamins, these homocysteine levels rise, and high homocysteine injures arteries, just to say the least, and there's a number of other things. So these tests that I'm talking about that measure lipid or cholesterol size, particle number and size, and these risk factors are very, very underutilized. Very underutilized, and that's a shame because many people have traditional testing and they say, wow, I'm pretty healthy, but in actuality could still have high risk. There are many people who have great outward health, they exercise regularly, they run, they walk, they lift weights, still have unexpected heart attacks. So you have to prioritize and protect your health. Health is one of the most important gifts that God gives to us. So I think you can take advantage of today's the best cardiac testing to identify your risk. Gaining knowledge about what these tests will not provide any benefit to you unless you're actually tested. So blood testing is very easy. It identifies crucial problems. It provides excellent treatment options to correct or manage any problems you might have. The tests are covered under insurance most of the time, depending on your insurance coverage. What I do is just get a medical and family history. I can order the most appropriate preventative cardiac profile for you. And if you are in my age category, Medicare age, many of these cardiac profiles are covered completely, and that's good news. They're sophisticated tests. They are a little pricey, but they give us tremendous information. So if you have any questions, please call. I'll be glad to just chat with you briefly, further explain how you can be tested to measure for your cardiac health status. Please refer to my website. It gives an overview of the benefit, some of the benefits of being tested in this manner. And thanks so much for taking your time. Central High Functional Medicine Health and Wellness Consulting is the place to do advanced laboratory testing and improve your health and wellness. So again, thanks so much for taking your time to listen.